And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on INtegrativeNMC.
Hi, this is George Gordon. Today on Boomer Life, we're joined by the professionals of the Integrative Naturopathic Medical Center in Vancouver. We're going to be talking about oxidative therapies, the treatment of cancer, how you can live a better life, and perhaps find a path to something better than you have been dealing with already. Something new happening at the clinic, and we'll get to that a little bit later in the show. First, I would like to introduce naturopathic physicians, Dr. Larry Chan, along with Dr. Alex Chan. Larry and Alex, welcome to Boomer Life.
Thank you.
All right. Larry, why don't you lead off? Tell us a bit about yourself.
I'm a naturopathic physician and a chiropractor and acupuncturist by training. And I've been practicing for over 30 years. It's a fast 30 years that's gone by. And I have a great pleasure also. I'm working with my daughter now, Alex, who will be speaking next. But basically, my interest over the 30 years is to be creating a clinic that deals with people's well-being, not just their disease or their sickness. It's really trying to help them discover what makes them healthier. We can take them with their health concerns and strengthen them and go from there. That's our primary interest. My personal interests have been in physical medicine initially. I do a lot of regenerative injection therapies, prolotherapy, neuroprolotherapy, many injection therapies for arthritis and sports injuries. But I also treat a lot of systemic problems, such as anti-aging therapies, what we call age management, and also we treat a lot of cancer in our office as well. So that's basically my background.
Okay, Alex, tell us a bit about yourself. I kind of think I know where you started to get interested in this.
So I was very lucky. I got a very early exposure to alternative healthcare and naturopathic medicine, obviously, through my father, who it's such a pleasure to work alongside. And then my mother's also a registered massage therapist. So I guess I kind of had it coming. But for myself, I think that being out, one of the things that I saw when I was much younger and earlier in my career is how many people are affected by things like cancer, and as well as just systemic illnesses, chronic conditions, diabetes, heart disease, arthritis. And so for me, I really wanted to focus on a lot of those internal medicine complaints. I do other things in my practice as well, but cancer care has been a huge focus of mine. And I think that started also from a very personal place, not just seeing other people and other people's families affected, but for myself, knowing that I never got to meet some of my grandparents because they had passed from a very young age from cancer, and then also that my father had cancer at the young age of 19. So seeing how much that can impact people really started me on this journey.
Well, and it's an amazing journey for, I think, people in Canada. 40 years ago, naturopathic medicine would conjure up a lot of false images, voodoo, and often was frowned upon by allopathic doctors, what we call the standard medicine, the standard physician. It's come a long way, and in actuality, what you're doing is looking at ancient practices and ideas, and they're being updated all the time. So naturopathic is now works in harmony with allopathic, and in some cases is a great alternative.
Very much so. When I first started the clinic, Integrative Healing Arts, now called Integrative Naturopathic Medical Center, with my two partners, Eric Posen and Hal Brown, and we were chiropractors, and then we added naturopathic medicine and Chinese medicine to our process. And we were one of the very first clinics in all of Canada to be called Integrative something. Now, if you look through the phone book and look through I guess nobody will use phone books anymore, but you Google up, you'll see integrative everywhere across Canada. And it's because medical doctors are also embracing the idea of medicine can't just be in isolation. You have to look at the whole body. And you have to look at the impact of functional medicine, which is what is your body doing, what's your immune system like, and what's the environment interacting with your genetics. And that's the key. So our work in our Integrative Naturopathic Medical Center is really about how does our genetic body get expressed as caused by the environment. So lifestyle has a lot to do with it. So our basis of our function is about how do we alter those factors in our bodies to keep healthy.
It sounds to me like this is, you're involving the patient in understanding their condition, whether they're just not feeling well or whether they have a serious sickness or a disease like cancer. You're educating them as you go along.
And the goal is also to make sure that if they are coming to us in a place where they don't yet have any sort of illness, we all know that as we get older and as we get exposed to more toxins and have more challenges from a health perspective, the likelihood increases of developing something more severe. And so working from that preventative basis is where we prefer to work, but then also being able to address more serious conditions if they're already present or as they arise.
And a lot of alternatives to invasive measures that are often, if you can treat the body and help it heal itself, then perhaps avoid surgery.
Very much so. I mean, really, allopathic medicine or traditional medicine, as we see it as hospitals and et cetera, is really a crisis intervention medicine. You know, the emergency ward is really important. So a simple example is, if I get hit by a car, don't send me to my naturopath. Send me to the emergency ward at VGH or Burnaby General, because they're the ones that are going to patch you up and get you out of crises. But to recover properly, get me into someone that works with the physical body as a whole. Get me back to exercise, get me the right nutrition, all those factors. So that's really the marriage of the two has to come together, and in terms of traditional allopathic medicine and alternative medicines.
And also with that idea in mind, so with the conventional model, which works so well for that acute situation, people I think now are looking for something more than I feel okay. They want to feel great. Mm-hmm. And so it's about taking people that perhaps have had some sort of major incident, whether it's hit by a car or had a heart attack or have a chronic condition. And their doctor, their conventional doctor, has them on some sort of acute management for that. But now they want to have better energy. They want to really optimize their health aside from kind of that just acute situation. They want to stay out of crisis, obviously, but they want to live a really healthy and fulfilling life. And that's where I think naturopathic comes in and plays a really different role and a very adjunctive and supportive role with conventional medicine, that we work together to really have the time and the ability to focus. And our specialty is being able to tweak all of those lifestyle factors, being able to tweak nutrition, exercise, and have the time to discuss that with their patients so they really understand and can feel empowered with their own health.
Is allopathic medicine embracing, as opposed to considering itself the only form of treatment, are the professionals in the allopathic healthcare starting to embrace the naturopath? I
think just from standpoint of public education, I mean, there's so much more accessible to patients in general, and the general public, that they're demanding much of that at this point in time. So I think allopathic doctors have to more and more look at that and incorporate it as a factor of alternative medicine, something that's important for them to identify and also to acknowledge.
And you see a lot more conventional medical doctors calling themselves functional medical doctors and trying to almost embrace a lot of the natural elements and talking about things like diet and nutrition and talking about supplements beyond kind of the RDA required values. Things like supplementing vitamin D now is a very common recommendation you could get from your naturopath or from your conventional doctor.
Well, times they are changing, and hopefully for the better. One of the great scourges of our time, despite everything that we've been able to do to treat it, is cancer. And the naturopathic way has found new ways in dealing and helping cancer patients. Let's talk a little bit about that and some of the cancer patients that you're working with.
I think the key thing with we call it integrative oncology or integrative cancer therapy at our center. And it really is it's a concept of, I think in terms of allopathic medicine, the primary area is they diagnose and then they try to kill the cancer cells or treat that process. What we do is we acknowledge that as well. We have to diagnose and treat, but we may use other methods to help treat. We may support the treatment by the allopathic, but the other part of the equation is how do we get the patient stronger and keep them healthier? How do we build their immune system? And how do we restore and keep their vitality intact? Because you don't want to trade off short-term gain, i.e., chemotherapy or treatments, with long-term loss. You don't want to mortgage your future purely just for treatment short-term. So we want to look at all those aspects. How do we kill the cancer cells? How do we keep the body healthy through the process? Support the immune system and keep your vitality up. And that's kind of how we approach it.
And then also, how do we make sure that we preserve your body and rebuild its function after treatments? Because conventionally what you're looking at still is largely chemotherapy, radiation, and surgery, all of which are necessary invasions in many cases, but really do a lot of detriment to your healthy tissues as well. And so getting people through their treatments conventionally, and then also picking up at the end of their treatments to make sure that whatever was the dysfunction in their body, in their biochemistry that allowed that cancer process to occur, we're preventing that from occurring again in the future. So I talk to my patients all the time, especially newly diagnosed patients, and I tell them that if they manage to get through the process and they're dedicated to working with me and working with their other doctors, that by the time they are fully through their treatments and they're cancer-free, they will be healthier on the other side than they went going into it.
Well, it's amazing that in years gone by, cancer patients who would go back to smoking, for example, and you learned, now you're just adding fuel to the fire. And you see so many people who suffer the ill effects from chemotherapy and radiation, that their system does get weaker. And I mean, even if it's not allowing the cancer to come back, there are other illnesses that can attack the body if you are not able to fight it.
Absolutely, that's exactly the point, because really the key thing is not just you have a diagnosis, and we have to empower and inform the patient and take responsibility. The patient has to take responsibility, because once you have the disease, as it is now, the doctors treat you, you're disempowered, you get treated, now you're cured supposedly, you go out and return to your previous lifestyle. Like you said, go back to smoking. And how can that be a solution? And then what the allopathics are doing is they're waiting for the next shoe to drop, which is you get sick again, say 5 years down the road. So we want to look and say, how do we empower the patient to understand it, take better lifestyle choices, strengthen their immune system, keep their vitality, and prevent this from occurring. Like you said, get them healthier at the end point.
We're going to be right back here on Boomer Life on CL 650 with the Integrative Naturopathic Medical Center physicians, Dr. Larry Chan, and naturopathic physician, daughter, Dr. Alex Chan. And we'll be talking about the role of this naturopathic medicine in dealing with everyday health problems, the more severe ones like cancer. Something new that's coming up a little bit later in the show that they are really developing that will, when they explain it to you, it will make so much sense, and in the years ahead could play a major role in the treatment of many cancers. You're listening to Boomer Life on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.